Hi, I'm Debbie Rakicki with Permanent Makeup Solution, and I'm here in my office, Dr. Perlman's office in Boca Raton, Florida. And I just want to let you know a little bit about my certificates. This state is not regulated, and I have gone to the permanent makeup class at the Florida College of Natural Health. I've also got advanced areola pigmentation classes, and I am a member of the SPCP. It's a national organization for permanent makeup, and I also have advanced in bloodborne pathogen. It's for the health and safety of my clients. And this is my office. Everything I use is sterile, comes right out of the package, and anything that touches your face gets disposable. And here's all my pigments. I use a Dr. Grade lidocaine cream so you don't feel any pain. And right here is my table. And I'm going to begin working on a patient, client, friend of mine, and we are going to go do her eyeliner and her eyebrows. And here she is, Bojana. And we're going to apply the cream. See that it's going to numb it really well. On a scale of 1 to 10, maybe she'll feel a 1 or 2. And if she feels anything, after the skin's pricked, we can go back in and put another cream on it. So you're going to watch the procedure step by step.
Action.
Okay, we're about to begin. Bojana already had permanent makeup. She had her brows done and her upper and lower eyelids. So she's coming back for a color adjustment about 2 years later. So what we're going to do, we're going to start with our Dr. Grade lidocaine cream. I'm going to take an applicator out of the container. Again, everything I use is all disposable. Start with the right out of the container. So now we're going to numb the bottom lids. And she's going to look up for us. And first I clean them. I clean the area, and then I apply the lidocaine cream to the bottom. And we'll do the other eye on the bottom. Okay, now we're going to apply the numbing cream to the top. Again, this is a lidocaine numbing cream, and with the permanent makeup, it numbs so that you don't feel any pain. But eyeliner is actually a little annoying. You do have the twitching of the eye, you do have a little tearing and watery eyes, something that you can't help, and you do have, they are bloodshot sometimes. So what you'll do is, and now we're going to numb the eyebrows. Your downtime is about 24 hours. When you leave here, you feel like you had a good cry. You feel like you were rubbing your eyes, they're tired, they're a little sore, and you know, you just want to relax. So I put a little bit of ice on it before you leave, and for the next 4 days you're going to go and also put some A&D ointment on it, which I give to you. And before you leave, I put ice on it, and I also will give you some A&D, and that takes down a lot of the swelling. And here we're numbing the brows. And this procedure, we're going to let this numb for about 15-20 minutes, and then I'll begin the eyeliner on the lower lid. And then she will leave looking beautiful and waking up in her makeup. Permanent makeup is great for someone that's really active, in the gym all the time. They want to look good. They're worrying about, you know, their shape, their body. Well, they want to look good when they come out of the gym. This is just as good. People that have a problem with their eyesight, wearing glasses. So now we're going to wait 15 minutes, and we will be back, and we will begin with the procedure. We're starting. Okay, now Bojana's numb. We numbed her upper and lower lids, and we're going to begin with her lower lids for her liner. She's picked a black and a blue for the inside, and she's been numbing about 15-20 minutes, and now we're going to begin. We're going to go right along the lash line with the black. Bojana has already had permanent makeup, and she gets it refreshed about every 2 years. And that's about the average. You'll go about 2 years, every few years, and you'll want to get it refreshed. The creams that we use on our face, if we swim, if we, just the natural exfoliation of the skin, you'll want to just keep it looking fresh and natural. The pigments get absorbed in the skin. And as you can see, I'm going to ask Bojana to look up to her left so that the eyeball is in the other direction and there's no vibration. Now we're coming to the middle. And everything that we use, again, is sterile. We use gloves, masks. I use a cover on everything to keep you nice and healthy and sterile and a clean environment. And there you can see, we're just about done. We go over it once one way, and then I'm going to go back the other way. And it's virtually painless. And again, she just has a little bit of a bloodshot. You can or you can't. I'm giving you the worst case scenario when I said before. That's the worst case scenario for you to be looking teary-eyed, you know, like you had a good cry. But most people, they can leave here and go right out afterwards. Okay, now we have Bojana. She's completed her upper and lower eyeliner. And we've even done, just look up Bojana. We've even put the blue inside, and we've made it nice and thick. It's very attractive. The corners of the eyes we brought up to open up her eye, and she can wake up in her makeup. We basically just put a little bit of ice on it afterwards to take the swelling down. And this is directly afterwards. She can go out and just put a little bit of Visine in her eyes, and she's ready to go.